Colorectal cancer is among the most common cancer diagnosed in both men and women in the U.S. March is Colon Cancer Awareness Month, and joining us this morning to discuss the importance of being screened is Gundersen Lutheran gastroenterologist Dr. Frank Aberger. Good morning, Dr. Aberger. Thanks for getting up with us.
Good morning. Thank you for having me.
Let's talk about this screening. It is not a very fun event for anyone, but it is so necessary.
Yes, it is. Colon cancer screening is very important because colon cancer can have no symptoms in many patients, and colonoscopy can pick up polyps, which are growths in the colon, which can over 5 to 10 years turn into colon cancer. So colonoscopy, we feel, can prevent the majority of cases, not all, but the majority of cases of colon cancer from developing.
Now, the colonoscopy itself isn't probably what people don't look forward to. It's the getting ready for the colonoscopy. Can you kind of explain how it works, and is it as bad as it's said to be?
Well, it is very, very important to be cleaned out properly for colonoscopy so that the gastroenterologist can see properly and see these growths that can turn into colon cancer. Most patients feel the actual preparation is indeed worse than the actual examination itself. It does require getting cleaned out with various laxative preparations. The most common one is an actual gallon of laxative preparation that's split up over the course of a day. And although this isn't pleasant, it is very doable, and it is really very necessary. There are other laxative preparations also, some of them not as effective, however.
Okay, and of course, the most effective, the better test results you get, and therefore the better screening. If colon cancer is caught early, say at your annual colonoscopy, what is the success rate like when it comes to treatment?
The success rate is extremely high, and it is very, very curable. And sometimes even taking out the polyp that has an early cancer in it with colonoscopy is in and of itself curative. And if that is not curative, then early surgery, and most people have the conception that colon cancer surgery, results in having a bag or an ostomy. And in fact, that is false. Most colon cancer surgeries don't result in having an ostomy or a bag. It is some of the cases that do, but most do not. But when the surgery is done and the cancer is caught at an early stage, it is almost always curable.
Wow. We are out of time, but real quickly, when should people begin being screened for colon cancer?
Well, an average risk person, that's a person with no family history, no prior history of polyps, should be screened at age 50.
50 and up. All right. I still have a couple years. Thank you, Dr. Aberger, for joining us this morning.
Okay.